You're listening to Lessons Learned on Mitigation Journal, the All Hazards Podcast. Welcome to Lessons Learned, exclusive content for the Mitigation Journal app user. Lessons Learned is a production of Mitigation Journal, the All Hazards Podcast. Lessons Learned takes a look at previous events in case study fashion with the lessons learned applied to today's needs. You can be part of Lessons Learned by email mitigationjournal@gmail.com or by calling the voicemail line at area code 585-672-7844. You can subscribe to Mitigation Journal at iTunes. Subscription is free. Visit our blog, mitigationjournal.blogspot.com, for daily postings and updates. And thanks again for joining us on Lessons Learned, a production of Mitigation Journal, the All Hazards Podcast. Today we're talking about some patient assessment tips in trauma, and I'm just going to offer a few pointers to keep your trauma assessment on track. Tip number 1. It's okay to be distracted by traumatic injuries, but it's not okay to be fooled by them. Traumatic injuries to the face, to the head, or open injuries to the chest, abdomen, and to the extremities can certainly be distracting to your assessment. Being distracted by the devastating injury or injury pattern is a natural human response. The paramedic, however, cannot be fooled. No matter how devastating these injuries appear, they are not the only injuries or the most serious injuries the patient may have. The point is that no matter how or what has been ripped open, sticking out of, or impaled into the patient, the paramedic must fully assess the patient, the mechanism of injury, and the surroundings. Tip number 2. What lies beneath? Understanding the anatomy in relationship to injuries and injury patterns and mechanism of injury is very important for the pre-hospital care provider at all levels. It's not enough to simply observe an injury from the surface. The paramedic must understand the implication of that injury on the tissues, structures, and organs that lie beneath. What appears to be a superficial soft tissue injury on the surface can be a substantial structural or organ injury underneath. Only by possessing a solid foundational understanding of anatomy will the paramedic be able to relate the exterior body damage to where the true injury is, that is, to the structure, organ, or system that's impacted by the trauma. Tip number 3. No matter what the injury pattern, or mechanism of injury is, always assess the head, the neck, chest, abdomen, pelvis, and long bones. These areas often go unchecked when we focus on a single injured area of the body. The point here is that no matter where the injury is, all of these areas have to be assessed, even if they appear uninjured. A simple note on the neck. We spend a lot of time in EMS worrying about the C-spine and injuries to the posterior neck, and that's a good thing. But we can't ignore injuries to the lateral aspect of the anterior neck, including assessing the vessels and the airway. Tip number 4. Change your point of view. We far too often assess patients while they're lying supine, staring straight down at them. After all, that's how we teach you to do it in EMT school. But to be effective, you've got to change your point of view. Get down on the patient's level and examine from each side. Survey the patient from a short distance. Observe a few breaths while kneeling at the patient's feet or the head. Get the best look at the patient that you can, not just a one-dimensional staring down at them perspective. Tip number 5. Assess any trauma patient for hypothermia and assess any hypothermic patient for trauma. Think trauma equals hypothermia, and hypothermia equals trauma. Trauma patients may lose the ability to thermoregulate and have a difficult time keeping warm, especially if there's uncontrolled internal or external hemorrhage. Hypothermic patients may not feel the pain associated with an injury and may not have the mental ability to comprehend the injury and report it. Let's sum up our trauma assessment tips then. Tip number 1. You can be distracted, just don't be fooled. As long as your momentary distraction does not lead to being fooled by a nasty-looking, less serious injury. Tip number 2. Think about what lies beneath. Anatomy lies beneath, and your understanding of that anatomy will lead to better assessment and treatment. Tip number 3. Always assess the critical areas: head, neck, chest, abdomen, pelvis, and long bones, even if they seem uninjured. Tip number 4. Change your point of view. Move around. Look at the patient from various angles, various viewpoints, and from a distance. Get as much of the picture as you can before you leave the scene. And tip number 5. Trauma and hypothermia. They go hand in hand. Any trauma patient should be assessed for hypothermia, and any hypothermic patient should be assessed for trauma. I'm Rick Rosati, and this is Lessons Learned on Mitigation Journal, the All Hazards Podcast. Email us, mitigationjournal@gmail.com, or call the voicemail line at area code 585-672-7844.